Absolutely. Magnolia Health started in Mississippi in 2011 with a real desire to improve the health care of all of those members who we provide health care services for. Really, it can be boiled down to getting the right care at the right time at the right place. The Affordable Care Act has definitely had an impact on our business, and one of the things that we've seen are more people who have qualified for Medicaid under some of the new eligibility rules that have been presented through what we call MAGI requirements in the Act. And so we've had to adjust for this increasing enrollment to make sure that we provide the services that members need when they become eligible for Medicaid through the Affordable Care Act. I think the future for healthcare in Mississippi is very bright. I think that what we found in Mississippi is often our good stories have not been told. While we have a number of areas in Mississippi with regards to obesity, diabetes, hypertension that we can improve, cardiovascular care we can improve, there are many things that we do well. The surgeons at Blair E. Batson are world renowned for many of the new technologies that they are bringing to the field of pediatric heart surgery. And I think one of the things that we've got to do to ensure that Mississippi continues to have a very bright future is to tell our positive story while not being scared to tackle the issues that we really face to improve the health outcomes of all of Mississippi. The most important factor for lowering healthcare costs in America is really to focus on getting evidence-based care at the right location to receive that particular service. One of the challenges is that we have gotten into a habit, if you will, of thinking that we have to provide very high-tech care when in fact more high-touch care will provide what people need to improve their lives. Great question, and one of the things that we know is that some of that spending is for things that may not have a good evidence base behind why they are done. We often overutilize unnecessary services, and I think something can be done about that. You see what is being done currently with really looking at following evidence-based medicine protocols. Not that everybody's going to fall into a, quote, cookbook medicine template, but there is a foundation that we ought to start as we work through, and then if somebody doesn't meet the mold, then move outside of that. Unfortunately, we have gotten in a habit of providing a very large volume of unnecessary services that could really help us rein in cost if we move to a more standardized model. You see this with respect to the way that healthcare is delivered, and you see large variations in care. So if we took a more standardized approach to looking at things and really followed that more almost of a model of where we get just the right care just in time to look at what waste is in the system and people get exactly what they need, I think we could do a great job at lowering the amount of GDP that goes to healthcare.